Welcome back at 6:45. As we've been reporting this morning, Philadelphia now has its first probable case of monkeypox.
Well, joining us live with some important information is Dr. Rob Danoff from Jefferson Health. Good morning, Dr. Rob.
Hi, good morning. How are you guys?
Doing well. So let's ask, first of all, how quickly can this virus spread and how concerned should people be?
We should be aware. We shouldn't be concerned. You know, we've been going through COVID. But monkeypox, what's unusual is that it's showing up in areas that it usually hasn't. And, you know, it's in over 30 countries right now, over 550 cases.
My battery.
In the United States right now, there are 21 cases in 11 states. So what is good is that we're tracking this very well. So just follow the news. What they found is if it's in a certain area, you know, we have SWAT teams. So people go out and identify the person, and also who that person has had close and intimate contact with. So I would just follow the news and just keep up to date, but please don't be scared, just be aware.
All right, Dr. Rob, tell us what symptoms people should watch out for.
You know, this is like the flu. It can come on. So fever, chills, headache, muscle aches, and then a few days later, what will happen is you get these swollen lymph nodes. It could be in your neck or under your arms or in your groin, and these are things that help fight infection. And then this really weird exhaustion. And then what happens is about 1 to 3 days later, these pox marks formed, and these are basically like fluid-filled areas like vesicles. Think of chicken pox, but it looks a little bit different. And it's with monkeypox, it tends to be on the face, the palms of the hands or the soles, on the arms or the legs. Those are the most common areas. So what we're advising is, of course, if you're feeling sick and you're not feeling well, please stay home, just like we've learned to do, and call your healthcare provider or the local health department if you don't have a physician. But, you know, this monkeypox is something that we suspect has been circulating for a little while undetected because it is appearing in different countries at similar times.
Well, how good are we at tracking this disease?
You know, Jim, one thing about COVID is it taught us to track better. So the public health systems are on more alert. And so right now, the fact that they have identified 21 cases in 11 states is good. So that means that our surveillance systems is good. And people often ask, well, what happens if they're exposed to someone with monkeypox or they found out? Well, what they do is what's called ring vaccination. So what they do is they find people who have had intimate contact. So I want people to know, just by like being near someone, I don't want you to worry about that. This is mostly potentially spread by intimate physical contact with those areas of skin that have these lesions in the infected person. You know, or if you're really close and kissing and having that, you know, they're coughing or breathing on you. But just being around the air or around someone, that's not how it's transmitted. So again, it's just close contact. So people, please don't be afraid. Just follow the news and be aware. If it's in your area, you'll be advised what to do. And believe me, if you have been in close contact with someone who ends up having this, the SWAT teams, you know, who are investigating this will contact you. And there are measures we call countermeasures that we can take to decrease a person's risk of getting this monkeypox, or at least decreasing the severity of it.
Always good advice. Thank you, Dr. Rob. Appreciate it.
Appreciate your insight as always, Dr. Rob. Have a
All right,
great
thank
weekend.
you guys.
Take care.
See you soon.
You too. Be well. See ya.
Thank you.